Welcome to the studio at North Rim. I'm your host, Adam Klugman. And this week, we've had a number of holistic healers on the show, many of whom work together at a collaborative holistic health clinic here in Portland called HeartSpring Health. Today, our guest is the owner of HeartSpring Health, Dr. Serron Wilke. She is herself a naturopathic doctor who works with and directs other holistic practitioners across a broad spectrum of disciplines to bring about the Heart Health Spring vision, to serve individuals, their families, and communities with radiant health. Dr. Wilke, welcome to the show.
Thank you, Adam. It's a pleasure to be here.
What exactly is HeartSpring Health? I find this model really interesting.
The vision of HeartSpring Health really came about when I started my own practice as an individual, and I brought in some other practitioners to help with patient management and whatnot. And what I noticed and watched happen when I had other people and we were working collaboratively together is that patients got better faster, and we all had a lot more fun doing it, including patients, and I wanted to expand that, so I just kept going.
How long ago did you start it?
I started my practice about 9 years ago, and the clinic really was born about, that would be 7 years ago. So at that time, there really weren't naturopaths working together in a collaborative way. It was a lot of individual practitioners. I describe it as people being their own islands and trying to provide everything that they knew how for a patient. And in a lot of ways, that's limiting.
That's what I found so interesting. Not just that it was all in one place, but that you confer together.
Yes.
Right? So you might be, patient's not getting better. Tell me what that process might be like. What does that look like? I just think this is a really interesting way to do it.
Yeah, well, I think that this is a pretty big distinction. There are also a lot of clinics where providers are in the same building but are still not collaborating. So in this particular model, we are collaborating. If somebody comes in with pain and they need to see multiple types of practitioners, they can do that all under one roof. And not only will they get the expertise of that particular provider, but they will also get the expertise of people coming together and talking about where they could do things better. Are they stuck in some way? Is there a way that we can move things along at a faster rate?
How many practitioners do you have at HeartSpring Health, and what disciplines?
I'd say we'd have somewhere between 12 and 15 providers at HeartSpring Health at this time. We have massage therapists, we have a chiropractor, we have acupuncturists and naturopathic doctors. There is... in terms of, one of the things that I've really tried to seek out in the providers that I bring on at HeartSpring Health is that each of them, while they're all trained very generally and they can, treat a wide range of people's conditions, I've looked for people who really have a passion about something that they feel really excited about, so that there's something that they kind of specialize in that helps them stand out from, any other provider that might be available in Portland. We have people who really are passionate about trauma care. We have people who are very passionate about sports medicine. We have people who are really passionate about cancer, women's health, to name a few.
I'd like to talk a little bit about your practice. You're a naturopathic doctor and also a licensed acupuncturist, but I would like to talk about being a naturopathic doctor. What is the difference between a naturopathic doctor and a medical doctor?
Yeah, that's a great question. A naturopathic doctor, does all of the same education that a medical doctor does. There's all the same prerequisites. Medical school is structured the same way as any other medical doctor. The main difference is that as we go through our education, our focus is on how do we restore a patient's health. What does health look like? So even in pathology class, which definitely goes over, each of the different pathologies. We're looking at not how do we treat that pathology, but how do we restore a person's health to, optimum.
I see. And how does naturopathy define health versus how a medical doctor might define health? So
right.
There's some differences there.
There are some differences there. A medical doctor, I don't want to perceive what a medical doctor, how they actually would perceive health, but I will say that a naturopath is going to look at what does the people who have the least amount of disease are happiest in life. What are the qualities, what are the characteristics, what are the signs, the symptoms that tell us that this person is really functioning optimally in their life, in their communities.
Kind of not just the absence of symptoms, which is how I often feel that Western medicine defines health. Well, if you have no symptoms, then you're healthy.
Right.
And a naturopathic doctor might take a very different view of that.
Absolutely. Absolutely. It's not just the absence of symptoms. It is, is this person vibrant? Do they feel big and confident and calm and reassured? And those are all signs of health and vibrance.
Like thriving. Are they thriving?
Yeah.
Right.
Yeah.
As opposed to the absence of symptoms. Is this person really thriving in their life? I noticed in some of the literature I read on the website was about helping people kind of reach their fullest potential.
Right.
How does health factor into that? Oh, I know what it was. I remember you said our thoughts influence our health, and our health influences our thoughts. And I thought that was really interesting. I kind of get the first part. I'm kind of lean toward the naturopathic New Age side of things. So I get that my thoughts about myself will determine my health. But this idea that the state of my health will also determine what I think, I thought was very interesting.
Yeah.
Talk a little bit about that.
Well, I mean, it's an interesting phenomenon. When we aren't feeling well in our body, it has an effect on our confidence. It has an effect on our ability to feel like we are capable, that we're strong enough, that we're resilient in some way. And instead of working from a model where there is abundance and where there's vibrance, we're working from a model of, can I do this? Is this possible for me? So it does definitely change our thoughts.
I really like that. That really struck me. It made me think about some of my own negative thinking patterns and wondering, wow, I wonder if I felt healthier, if I would be thinking better thoughts. Right? Maybe some of the negative thinking that shows up is a product of not being as healthy as I could be. So that really made me think. I really like that. Let's talk about I noticed you treat a pretty broad range of people.
My personal practice, I would say that I work as a primary care physician, so I may be the point of contact for a great deal of different conditions. Certain things are certainly, I would say a motor vehicle accident, for instance, is something that I would probably refer out for. But I do tend to focus my own personal practice on anxiety, depression, cancer, chronic pain or chronic conditions, things that really do involve typically they involve somebody's health on a mental, emotional, and physical level.
Do you find that there are common causes to things like anxiety and depression?
Yeah, there's always themes. I do really focus on individual people. So we all are part of the human condition. So absolutely, there's definitely themes there. But I tend to be a little bit more focused on who the person in front of me is as an individual.
I think that's another important difference that I experience in naturopathy and holistic healing versus medical and Western medicine, which is I don't always feel seen as an individual. I feel like I'm a set of symptoms that are presenting. And that was why I asked that question, because I think that's one of the advantages of seeing a holistic therapist is the individual is taken into account. And I think the best Western doctors do that.
Yes.
Right? The best Western doctors see you. You feel seen. That it's such an intimate relationship that you feel gotten by your doctor. And most of the naturopaths and holistic healers that I've seen, that was the experience. When I was perusing the website, I came across something called inner dialogue work. I actually noticed that it was trademarked. So that intrigued me even more, being from advertising. I know that means somebody owns this process, so it's some kind of proprietary process. Talk about this inner dialogue technique as a method of healing. What is that all about?
What inner dialogue does is it seeks to kind of illuminate the current story that is influencing us on a subconscious level, so that we can bring it into the conscious mind for a particular individual and help them at least be able to have the choice to either utilize that information consciously in the same way or make a different choice to move out of that pattern if it's no longer serving them.
So I saw something that I found interesting, because I'm also like a writer, storyteller, always interested in stories. Worked in advertising. It's all about story.
Yeah.
It talked about getting the body into a state of story. Did I get that right? It intrigued me. What does that mean?
Yeah. So essentially what it does is it uses muscle testing or kinesiology. And it also uses hand gestures called mudras. And those, anybody who's done yoga has probably read about mudras or maybe even done some of them. The different gestures are symbolic. So there's a part of our brain called the sublingual cortex that accesses or reads symbols and gestures. And so what the muscle testing can do is it can see if a person's subconscious mind is reacting to or resonating with a particular mudra or symbol. And those mudras represent in a particular, it could be a thought process, it could be, something. As soon as you start stringing some of these together, it creates a story. And it can help the person understand how their actions are related to this story, or how this story is kind of, informing their actions.
So it's kind of interpretive. In other words, you do muscle testing, you do mudras, and through that you're interpreting the story that's in the unconscious. Right?
Yes.
Is that kind of?
Yeah. Well, the physician is actually giving the information to the patient and repeating their own story back to them, so that they are then able to put pieces together that they may not have understood in the past.
Right. So it is somewhat interpretive. It almost reminds me a little bit of a dream, like interpreting a dream. The dream often operates in symbols, and
Yes.
so these mudras and these muscle testings are the story that's going on in the unconscious is coming out through this inner dialogue
Yes.
technique. It's really. I thank you
It is really cool.
for clarifying that. It sounds
really
really
cool.
be really interested.
Yeah.
All right, so you have an offer right now for people who are watching. If they were going to come in, will you tell us a little bit about the offer if they're going to come to HeartSpring Health?
If they come and see a naturopathic provider at HeartSpring Health, we're offering 50% off of a massage, and also 25% off of a one-time supplement order.
What do you think is the single most important thing someone should understand about holistic hair?
Well, I think that it's important for people to understand that holistic care actually is very much rooted in science. And it is the oldest form of medicine that we have out there. And it helps a lot of people that haven't been helped by other means.
Dr. Serron Wilke, thank you so much for coming to the studio.
Thank you,
It was
Adam.
great having you.
Thank you. It was a pleasure.